We're very pleased with these results, and I think all Queenslanders should be proud of the mighty effort that they've put in. So today we only have 3 new cases. Now, 1 is hotel quarantine and 2 are community acquired, but they are linked to the PA nurse. So it is another nurse at that PA COVID ward. My understanding is that she was vaccinated, so I'll let Dr. Young talk a little bit more about that. So we now have a total of 71 active cases in our hospitals. The number that have been acquired overseas is 58, so that's 58 out of the 71. And this is fantastic news that over the past 24 hours, there have been 33,408 tests. That is a massive, massive number. I think that's probably our highest. And I do want to thank Queenslanders for coming out and doing that. So if we see the same number of test results tomorrow, this is very, very encouraging news. The fact that we do not have any unlinked community transmission in the southeast or in our state is absolutely encouraging news. So thank you, Queensland. We are doing a great job, and together we will get through this. The number of vaccinations that were done yesterday was 6,809, and our total vaccinations since the start have been 71,942. So that is, of course, very good news. I know the Deputy Premier will have more to say about that. So as we said yesterday, from 8 a.m. today, only staff who've had their vaccine can look after people who have COVID in our hospitals. And I want to thank Dr. Young for putting that mandate in place. It makes sense, and that'll be an added protective measure for our staff. I just want to confirm that we do have a person who has COVID in the Bundaberg Hospital. We are not worried about that at all. They have not been out and about in the community. And of course, Bundaberg has actually treated a COVID patient before as well. And I also want to confirm that we also do have a person in the Toowoomba Hospital with COVID, and once again they've also dealt with COVID patients before as well, so, and they weren't out and about in the community. So look, what is really important over the next 24 hours is simply this: if you are sick, have any symptoms, go and get a test. Absolutely critical that we rule out any unlinked community transmission of COVID in our community. But the signs are very, very encouraging, and I really want to thank everybody who's been involved in this. Our contact tracers are first class. Our contact tracers are working around the clock. Please go and check, and I ask the media, please get out again across all of your networks, and we'll put it up on the Queensland Health website, we'll put it up on my website as well. We want to make sure that people go through and just double and triple check that you have not been to any of those venues that have been listed. If you have, please watch for symptoms, go get a test. That is absolutely critical that we do that over the next 24 hours. So very encouraging news today. Thank you, Queensland, and I'll hand over to Dr. Young.
So very encouraging news overnight, and the most encouraging news from my point of view is that 33,000 tests were done, because we can only find cases of transmission in the community if people get tested. So I thank every single one of the people who came forward yesterday and got themselves tested. That has been critical. So we had 3 new cases overnight. One was a case acquired overseas in India and diagnosed in hotel quarantine, so will be admitted to hospital. The other 2 were locally acquired cases related to our second cluster. So I already have the genome sequence back for one of those 2 cases, and is exactly the same as the genome sequences for that second cluster, related to the nurse and her friends who were in that party who went down to Byron Bay. So that's a linked case. We're now working through whether this second nurse in that cluster acquired it on the ward. She does work on that ward, and she was tested as part of the asymptomatic screening testing process for that ward and was found to be positive. She has since developed some symptoms but she was part of that testing. So we just need to work out how she got it on that ward. She had been vaccinated prior to working that shift. So we're just working through all of that at the moment, but that's very good news. So we now have 11 people in that cluster. Now, the first cluster, remember yesterday I spoke about 2 cases that we're investigating who we thought could be part of that cluster because of the epidemiological links and some initial testing. They've now been confirmed as not positive. They're not cases, which means we now have 8 in that cluster, that first cluster, related to the doctor who acquired the infection at the PA hospital. So those 2 clusters look like that they've all been worked through. All of those cases are linked, and we do not have any other cases out in the community anywhere in Queensland that are unlinked. So we do have some people admitted to hospitals, but they're part of that second cluster. So we do have an individual admitted to the Toowoomba Hospital and another to the Bundaberg Hospital. Both of those hospitals have managed COVID positive cases before, and they are managing those too. And because we got them so quickly due to that very fast action by that first nurse in that second cluster, we're not concerned that there's been any significant risk to the community. Having said that, these viruses are just so contagious. Both clusters are based on the B117 variant, which we know is very, very contagious. So please, anyone in Queensland, as happened yesterday, anyone with any symptoms, come forward and get tested immediately. Don't think it's because you've got kids who've been to childcare and they've had the virus that's circulating in childcare. Ignore any of that. Just if you've got any symptoms, please just come and get tested. And thank you to everyone for your patience in coming forward. This is a big load on the health system, but the health system will manage it and will test everyone who comes forward. That's really, really critical. But this is encouraging news overnight, and it's encouraging because people have come forward and got tested, and also people have followed all of the instructions. Here today, I can see, I think everyone, except us two, with masks on. That is fantastic. We need to continue that throughout the state, remembering that indoors is the most critical place to wear masks. Then going back to the seated drinking and eating so that you don't mingle around. That is so important. Limiting the number of people in a household to 30. That is so important for that area outside of Brisbane that isn't in the lockdown at the moment. Doing those things and protecting our most vulnerable. We've not quite got there yet with the vaccine for our most vulnerable. So that's really being rolled out now. So we do have to protect our disability accommodation, our aged care accommodation, our prisons and our hospitals, because that's where we know our most vulnerable people are. So thank you. No, sorry. Thank you. You're always very good at picking things up. So the first case is a nurse who's acquired it from that gentleman from India at the PA, and I have confirmation of that because I have the genome sequence. They did that very rapidly. Then the second case lives in the same household as that nurse. So it's household transmission, and we know that household transmission is our highest risk at the start of any outbreak. No, it's this second nurse. I don't have a genome sequence yet for that second person, so this is someone who lives in the same household as the second nurse. I don't have their gene, but I'm sure it'll be the same. They're the 2 overnight cases. Yep, so they're part of that cluster of 9 that I told people about yesterday related to the man from India. So you have the man from India who was admitted to the PA hospital. Right, there's been a transmission event to one nurse there who then went to Byron Bay and had a party in Byron Bay, and all of those people who were at that party, of course, have been tested. There were 10 of them, 6 of them are positive, and of those positives, 1 has been admitted to Toowoomba Hospital and the other to Bundaberg Hospital. Yes, Yes, yeah. There's nothing new there. I'm just clarifying where these people are. And we've got 2 on the Gold Coast at the moment. In the Gold Coast University Hospital.
And when was the nurse vaccinated?
On the 19th of March.
And how long does it take to be effective?
Remembering she's only had the first dose, so it usually takes a week after your first dose before you get a significant degree of immunity. Then you need to have a second dose of the Pfizer vaccine 3 weeks later, and it takes another week after that. If it's the AstraZeneca, you need to get that second dose 12 weeks after the first dose, and it takes another week after that. So she hadn't had a chance yet to have full immunity.
So things looking encouraging.
Yes. Encouraging, but we have to wait, right? So this is only one day of encouraging results. We need to get more results from today, so it is absolutely extremely important that anyone with any symptoms gets tested. So if there's any other chains of transmission, we pick them up immediately. Then we'll get those results tomorrow morning and we'll be able to then make a decision.
Do you know how the first nurse, do you know how she caught the virus in the first place, and how is it getting out?
No, we know she did not look after that patient, but we know she's got it somehow from that patient because the genome sequence is an exact match with no SNPs difference. So we know it has got from that patient to her, but she wasn't directly caring for that patient. She didn't have direct interaction, which means that there is most likely some environmental contamination or some aerosolization of the virus when the person was admitted, because remember the person was admitted at 8:30 p.m. into that ward and that nurse came on shift at 10 p.m. So that's why that ward has been closed. No one is going in or out of that ward. Everyone who was in there has been moved out, and there's been a very thorough clean being done of that ward. Their genome sequence is exactly the same. So, yes.
So at any stage were there COVID patients in Ward 5D and non-COVID patients at any time?
This is their infectious diseases ward, so they're all separate rooms, so they're all managed separately in that ward. They're all wearing PPE used, yes, in that ward. We just had transmission in a hospital resulting to 2 separate clusters. And those 2 clusters have happened at the same time, which is a big risk to manage too. So you would have seen that with the first cluster, I didn't advise the Premier that we needed to lock down, but as soon as we had a second cluster, the numbers were just becoming too big to manage.
When will the lockdown measures be reviewed, and when will you tell people?
Tomorrow.
What about these Gold Coast cases? Because when were you aware that there were cases?
So this lady, the nurse, went down to Byron Bay and she was in a party of 10, plus there was an entertainer involved, so there were 11 people. So I became aware that some of those people then had returned to the Gold Coast. So I became aware on Sunday that this had happened. So the nurse was fantastic. She really is to be commended. She developed symptoms at 11 o'clock on Sunday morning, immediately came forward and got tested. We had a very rapid testing turnaround, so we got that result late on Sunday. Then I had to wait for genomics to be able to piece it all together to work out where we are. And today, I believe we're Wednesday. I think so.
We were told about some cases on the Gold Coast yesterday, and obviously we saw the sites. Police were telling us about these cases on the Gold Coast yesterday.
Yep.
We went to Queensland Health and asked them.
Yep.
And they said they wouldn't comment. I mean, is that good enough transparency?
Well, I've been out here every morning giving information, so I'm not sure if I've seen you. I apologise before one of these briefings. But yes, I come out every morning with the Premier and brief with all the information I have, even when I'm not even sure about it, like those 2 cases yesterday that were still under investigation and have been negative, proven. No, we had 2 cases yesterday that I came and told people about, although I didn't even have confirmation, and now I do have confirmation they're not cases. So I will share as much information as I possibly can.
Contact tracing, when
Yeah.
you get the contact
Yeah.
tracing details, they go out to the media.
Yeah.
Does the PA, how many COVID patients does the PA deal with, and what's happening now with that?
Right, so we've moved them elsewhere in the hospital at the moment, and we're just looking at what we're doing going forward.
But you can send a lockdown so is it tomorrow or tonight? Because I thought the original decision was
Um,
we'll tell everyone at 9 a.m.
11. Yeah. Maybe I could clarify. There are 8 cases related to one genome sequence for a patient who has returned from Europe. That's the first cluster. And there are 11 linked to the gentleman from India with the genome sequence. Sorry.
So the testing on the patients with India, did that show that they had the new strain in India?
No, both of these cases have got B117, but they are different. We can see that on genome sequencing. There's no relationship between these two clusters. They're two separate clusters. 8:30 p.m. on the 23rd of March. Yes, yes. Correct.
Dr. Young, we've had some people in Gladstone, they went up to get a test, but the testing clinic was closed, so they were discouraged and told to come back on Monday because it wasn't open the next day. Should that be happening in the testing clinic? Those patients
No.
do test positive.
No, it shouldn't be, but we're working with them. There's a lot of pressure on our hospital and health services and on our fever clinics, so we're just moving resources around so that they can extend all of their clinics. Thank you. It has been, yes. So PA is not taking in cases to do elective surgery, except critical ones, of course. And some other hospitals have had to reduce some of their elective surgery, the less critical cases, to take the increased load from the PA. Yes.
And do you know how many PA staff are in quarantine at all or in close contact?
I don't have those numbers, but we have well over 1,000 people in quarantine related to these clusters at the moment. That was one of the positive cases went there. So a positive case visited the Mater, and the Mater Hospital is very, very well practiced at this. They've had other situations like this, so they immediately acted to go and test everyone who could possibly have been exposed. Yeah. Positive case from cluster 2.
Yes. Look, what I say to the public is this is very encouraging, and we'll be providing you with an update again tomorrow, 9 a.m. And fingers crossed, all will be looking good for Easter. But like I said, it depends on the testing rates again. So if we see very good testing rates across Queensland and we don't see any unlinked community transmission, the signs for Easter are looking positive.
What do you say to people from, say, Victoria or New South Wales or elsewhere in Australia who are planning to come here?
Well, we'll be making those decisions tomorrow, but if it's encouraging news tomorrow, we will be lifting the hotspot for Greater Brisbane. So, sorry? Oh, I think they should wait till 9 o'clock tomorrow. I mean, we're having 3 briefings a day. This is a very serious situation that we're in. And can I just commend Dr. Young? We are very lucky to have a woman of her calibre that is leading the state and giving such up-to-date information. She is absolutely thorough, and her advice has stood Queensland in good stead. When you look at what's happening around the world, where you've got UK just coming out of a lockdown, where you have a situation in other countries where people haven't been going to schools for 9 months, where businesses haven't operated and people aren't taking holidays, we do not have people dying in our hospitals from COVID. So I know this is an inconvenience to people, but these are the right steps and the right measures to keep and protect our state.
Premier,
I'm sorry, I can't help people who have got flights coming in on Thursday. You would have seen that we declared Greater Brisbane a hotspot. The Commonwealth has declared Greater Brisbane a hotspot, and other states and territories have done the same. So it will not be until we lift that hotspot that people will, be able to get surety. No, it won't be made Wednesday night. It is made on Thursday morning when we get the most up-to-date information. So we have 3 briefings a day. We get all the information we possibly can, and then overnight there may be cases that come in overnight. So the only time we can update people with the most accurate information is 9 o'clock in the morning. We've just come from a briefing at 8:15. We come and tell the public as soon as we get the most up-to-date information.
Are you satisfied with the efforts to get these frontline health staff vaccinated? Because we know the vaccines are there. I can give examples of instances where
89% of 1A have had their vaccines.
But we have examples where administration staff, public servants who aren't frontline health workers, have got their vaccines before these people.
Well, Tim, I'm sorry you weren't here the other day, but the health minister actually went through that in detail. And what she said is if you have volumes left in that vaccine, you don't discard it, you use it. And, the hospital staff are really important, just...
They are, but
that's right, we're not going to waste. No, we're not going to waste that vaccine. We're not going to waste that vaccine.
why are we stockpiling? Why are we stockpiling vaccines?
No, we are not stockpiling vaccines, and I'll get the Deputy Premier to talk a little bit more about that. But let me say this. Queensland is releasing its vaccine numbers every day. We do not see that from the federal government. Secondly, we need to have guaranteed supply, and we need to have guaranteed times of delivery. Now, I said this the other day, and let me say it again. I was on the Gold Coast University Hospital where they were undertaking their second vaccines. You'll all remember that. Some of you were actually there with me. And we were told that the supply arrived just in time that morning to roll out the vaccine. Now, we need surety of supply, guarantee of supply by the federal government, and if the states are releasing their figures every day, I think it's only fair and reasonable that the federal government releases their figures every day. Now, there is nothing more important at the moment. I know the federal government's been preoccupied with other issues, but it's time that we focus on this vaccine rollout. Now, the most vulnerable in our aged care homes are getting the vaccine by the Commonwealth, but they're not doing the staff. So, Tim, to your point, you're talking about staff. Why is the Commonwealth not doing the aged care staff at the same time they're doing our most vulnerable? That's a very logical question that this needs to be posed to the federal government. And because we don't have the regular supply. So what we needed to do is to make sure we had enough for that second vaccine. If the Commonwealth can tell us what their supply is, we are more than happy to roll out the rest of that as quickly as possible. But you imagine what would happen if we did not have the second dosage for people who've had their first in that 12-week period.
Priorities though, because we have, I can give you an instance where a public servant who isn't a frontline health worker, he got his vaccination weeks ago, yet his partner, who is a frontline 1A...
Yeah, Tim, I don't have those details on me, but...
I'm telling you.
Well, you might tell me, but I don't have those details on me. We'll investigate that for you. Yes?
Premier, the Chief Medical Officer, Paul Kelly, said yesterday there's no reason for states and territories to hold on to supply for that second.
Well, you ask them to tell me what is their continuity of supply. I think the public have a right to know. The public have a right to know the continuity of supply, and how about each week we get updated figures from the federal government about what the supply delivery will be. But look, I'll let the Deputy Premier say something more about that, but can I just add one more thing? I've also asked the Deputy Premier, and he's done a lot of work on this, and I thank Stephen for that, in relation to, we talked the other day about mandating the check-in app. So for our listeners and viewers out there, the check-in app is a really, really valuable tool for our contact tracers, and it means you just hold your phone up and your details have been stored, and you don't have to recheck in and stand there and spend 5 minutes remembering everything about your details. So what we'd like to do is mandate that for the hospitality industry. That'll come into effect on the 1st of May. But can I just hand over to the Deputy Premier to say a few more words about that, and also to address the vaccine issue. Thank you. Thanks, Deputy.
Thank you, Premier. What we've seen throughout this entire pandemic is every time the Morrison government wants to deflect from their failings, they launch an attack on the states and territories. And that's what we've seen overnight, an orchestrated attack by Morrison government ministers against the states and territories. And it really is quite outrageous. I mean, God knows they've got a lot to deflect from right now, not least of which their vaccine rollout. The Prime Minister committed that 3 million Australians would be vaccinated by the end of March. Well, today is the 31st of March, and he has fallen 2.4 million short of that target. It reminds me of when he promised that all Australians stuck overseas would be back by Christmas. Now there's still 40,000 odd Australians waiting to come home. Let's be very, very clear. The agreement between the states and territories and the Commonwealth leave responsibility for 70% of the vaccination task with the federal government. And of course, that's because we want our GPs and our pharmacists to lead the way. They are the trusted primary healthcare providers in our community. But ultimately, it is up to the federal government to work with them. I saw last weekend in the United States, they vaccinated 6 million people in one weekend alone. Now, turning to the states' vaccine rollout, and I note the questions that have been asked. We have not had certainty of supply to our hospitals through the vaccine rollout so far. That has required the holding back of enough doses to ensure that we can administer the second dose. Queensland has one of the highest dose administration rates of the states and territories at roughly 60%. But we have not had that commitment from the Commonwealth that those second doses will be there. The Premier has outlined how some of our hospitals have not known until the morning of how many doses they will have available. Now, I understand commitments have now been given about the second doses of the Pfizer vaccine, and that will allow our hospitals to use a greater percentage of the stock on hand. We would welcome that. We would welcome that also for the AstraZeneca vaccine. The public deserves, frankly, greater transparency about how many vaccines are available, how many are being administered, how many will be available in coming days and weeks and months. We provide that data, and so should the Commonwealth. I want to specifically address the particularly offensive remarks made by David Littleproud on the Today Show this morning. He said that if the federal government needs to do better, then they should get an uppercut. Well, it's time he should give himself an uppercut. The states are doing what they can with what has been distributed to them. I'd also make this point. The Premier has said that of the 71 active cases, 58 are from overseas. These two clusters originated with returning travellers. If the Morrison government had engaged with us on a national quarantine centre, it would be built right now. We would not have had to reduce the number of returning travellers. We may not have had these two clusters and the need to lock Brisbane down. And so responsibility there has to sit with the Prime Minister. I understand we have that assurity for the Pfizer vaccine, and that will allow us to use a greater percentage of the stock on hand of the Pfizer vaccine. I understand we don't yet have it for the AstraZeneca vaccine, and clearly it's even more complicated because you're dealing with a 12-week lead time, so you need to be planning ahead several months. Let me just confirm that's the case. Yes. Well, there's been almost no communication. You know, the Prime Minister has not contacted the Premier about this at all. The fact of the matter is our hospitals have used more of the doses on hand than any of the other states and territories other than, I understand, WA. They are just ahead of us. And that is in a very complicated rollout. You know, rolling this vaccine out across a distributed state like Queensland is much, much harder than other more highly densely populated states. We have not had that certainty of particularly second dose supply, but even first dose supply in many cases. And so, yes, you're right, communication could be improved. And I think one way of improving it is don't just make it transparent to us, make it transparent to the public, make it transparent to you in the media so that you can see exactly what's going on.
You made with Port Kelly though, saying yesterday that states and territories should be holding on, that they will get supply. I mean, is this a trust issue now?
Well, that's the first we've had that commitment. I understand it only applies to the Pfizer vaccine. Most regional centres in Queensland are receiving the AZ vaccine, but we would certainly welcome that commitment from the CMO for it. But let's be very clear, if they give that commitment, then it's them that you need to hold responsible if we don't have supply when it comes to those second round vaccines. That's not my understanding. Sure. So the app has been incredibly successful. 13,492 businesses are using it now. I know that the feedback from the community has been incredibly positive. Having a single app that doesn't require you to re-enter your details every time you go somewhere has been very welcomed. Other states, New South Wales and Victoria, have now mandated their state-based QR code apps. What we will do is require their use in hospitality businesses from the 1st of May. Licensed clubs that use license scanning will still have the option of using that for their record keeping, although we would urge them to have both systems side by side. This will allow for greater consistency, better access of data and a more convenient user experience. There is a turnaround time on businesses registering for the app. So we'd urge them not to wait till the 1st of May, get started now, apply online now to be able to use the Queensland Government's QR code app in your cafe or restaurant or bar, and we'll be able to roll it out very smoothly from the 1st of May. As I say, we're starting with hospitality, but there'll be consideration of other industries from there forward. Well, those targets were set by the Prime Minister, and it's up to him to outline how they will be met. As I outlined earlier, they've already fallen very, very well short of their end of March target.
Has the federal government missed any of its delivery dates to them?
Well, we haven't had certainty of what to expect in the hospitals, so it's been that transparency of what to expect and that consistency of supply that has been an impediment. I think our hospitals have done very well to hit 60% administration of doses on hand.
And where's your health minister?
I'll answer that. So the Health Minister, Yvette, contacted me this morning. She has a sore throat, so she's gone to get a COVID test. So the Health Minister is following exactly her own advice, and I encourage everyone else, if you have any symptoms as well, to please do the same and go and get a test. Now, we haven't heard from the Deputy Commissioner, so we might do that. Thanks. Steve?
Thank you, Premier. Morning. Just a quick update. So in the last period, since I spoke to you yesterday, we've done a total of 785 intercepts since the start of people in the community. We've responded to 153 calls for service. We've inspected 430 businesses, and I'm happy to say no fines have been issued. We've had one additional incident of a young person on a train who was a fare evader that didn't want to wear a mask, didn't comply, and has been issued with a notice to appear for failing to do so. That is the only enforcement action we've had to take in addition to the one that I mentioned yesterday. So look, overall, the levels of compliance of our community right across the state is fantastic, and we thank you for that. I just want to remind everyone that irrespective of what happens tomorrow, the decision, we are moving into Easter, and we can expect right across the state there will be significant traffic movement, and regrettably and tragically our road toll is currently 26 over what it was this time last year. So please, everyone, if you're travelling over Easter, irrespective of what the current conditions are, drive to them and expect police out in force. Thank you.
Are you seeing a lot of movement of people kind of fleeing from Brisbane to the coast?
No, not particularly. What we've seen, I think, is everyone understands what's required of them. We're very clear that unless you have one of the 4 essential purposes to travel, that you may not do that. So our officers are working with the community, and as you said, 630, if I didn't mention, 632 masks have been handed out. People are, once they realise what's required of them, are very cooperative. Thank you.
Last question for
Could I just please answer that question? That was very sensible. I meet with my colleagues, including the Commonwealth, nearly every single day, and the Commonwealth right from the start has tried to give us assurances that we would have enough vaccine, but then they had all of their issues, not of their making. So you might remember that we were meant to get 3.38 million doses of AstraZeneca from Europe. They're not coming. So some of them came, but not all of them. All of that has caused uncertainty and problems amongst the states and the territories and the Commonwealth. But we are doing this as collaboratively as we possibly can. The important thing is that we get vaccine and we get it into as many people's arms as we can, as quickly as we can. And that's what we're all trying to do together. The issue is supply. We cannot, as a nation, rely on supply until we're able to get those doses from CSL, and they're only just starting to come through. Once they really start coming through, that will assist enormously. That is the problem. It is supply. It's not any of the other issues. It is purely supply. And we do have to make sure that if we give the first dose, that we can give the second dose. And although the Commonwealth has done their best to try and assure us that we would get those second doses, at the same time we're getting information that supply is not progressing as we had hoped at the start. So it's just those, no one's deliberately mixing messages or causing issues. It's just that we're getting that information from multiple different sources and we're just trying to work it through. Now, whether we get this all done by October, I am desperately hopeful that we can have first doses by October, and absolutely our most vulnerable. So 1B is probably the most critical category. We're through 1A. There's a few there to sort through for whatever reason, they were away or unwell or whatever. But we're almost through all of 1A. It's now 1B. 1B are our most critical people. So they are our older people, 70 years of age and older. We know they are just so vulnerable to getting ill and dying from this vaccine. It's people under that age who are adults with underlying serious diseases. It's our First Nations people who are over age 55. It's our healthcare workers and it's our emergency services workers. That group of just over 1 million people are critical, and we will have them vaccinated well and truly by October. And if we get our most vulnerable vaccinated and we get the people supporting those most vulnerable, that is the really critical group, and we'll do as many others on top of that as we possibly can. Yes, I do. There were 10 people at that party and 1 entertainer, 11 people. So of them, we've tested all of them, of course, and already 7 of them are positive, 6 who are at the party and the entertainer. 4 of them are negative, but of course they're in quarantine now, and we're continuing to test them. And if they were to become positive, they've been in quarantine for their infectious period, so they're not a risk. No, they're all from Queensland and they've gone back home. That's why we've now got 1 in Toowoomba and 1 in Bundaberg and some in Gold Coast. We're still tracking down people from those venues. Of course we are. There's thousands. And that's why that app for contact tracing is so important, because it just helps us enormously to get on top of people quickly. But we're also finding that people have heard where these venues are and they're coming forward and getting tested before they even get the call. So that's really, really good.
Thank you, everyone.
Thank you.